Good afternoon. My name is Kim Stevenson, and I'm Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Work, Learn, Lead, How the Behavioral Health Workforce Institute's Employer-Embedded Pathways Grow the Workforce. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2026 annual sponsors and strategic partners for their support in underwriting today's webinar. This is just one of many events that we offer throughout the year to connect our members with leading experts to help address timely issues. I'm pleased to introduce our speakers from Accelerate the Future. Rebecca Butler is Chief Innovation Officer, and Ross Lohr is their Managing Director. Their organization funds employer-embedded workforce initiatives developed by the Behavioral Health Workforce Institute, and they will be showcasing models they help to implement across the career and education continuum. This is a timely topic given the many workforce constraints our members are facing. So thank you so much for being here today, Rebecca and Ross, and I will turn it over to you to get it started. Thank you.
Thank you so much for having us. I really, really need to get a new headshot. I feel like I'm that's like 15 years old at this point. I don't know what I'm doing, but really, really pleased to be here. Thank you so much for having us. My name is Ross Lohr. I'm the managing director of Accelerate the Future. We are a Massachusetts-based family foundation, and we are particularly interested in the behavioral health workforce. I'm joined here by my colleague, Rebecca Butler. Rebecca, why don't you introduce yourself first? We're going to keep this conversational and fun, but go ahead and
Absolutely.
introduce yourself.
Thanks, Ross. Yes, I'm Rebecca Butler. I'm the Chief Innovation Officer at Accelerate the Future. And Ross and I have been very busy launching the Behavioral Health Workforce Institute, which we will share more about with you all today, and some of the specific projects that we're piloting across the state to enhance and diversify the behavioral health workforce.
Awesome. Why don't you give a little of your background, Rebecca, because I feel like it's super relevant for this.
Oh, sure. This was not in our pregame. I am a social worker by training, macro for folks that use that lingo. I was on the community side for the first decade of my career in community-based delivery, really with a focus on adolescents and doing outpatient or ambulatory and community engagement. I then was at the state, the Department of Public Health and the Bureau of Substance Addiction Services in their Office of Youth and Young Adult Services, where we were able to fund and scale projects statewide, specifically trying to address and reduce adolescent risk for substance use and co-occurring disorders before going to Mass Health, where I had the privilege of serving as the Deputy Director for the Office of Youth and Families from the payer side. So really excited now to be on the philanthropy side, where we are able to innovate and really test projects that then we can put towards the state on a pathway for statewide and national expansion.
Awesome. And I guess I'm an entrepreneur by
Yes.
training. So I bring that side of things. And what we really are focused on is systems level change in behavioral health, especially the behavioral health workforce, which I'm sure many of you are working on and working with and trying to figure out better solutions for. And that is where we come to this work. So if you want to go to the next slide, we can kick this thing off. And so we're gonna talk about a little bit about Accelerate the Future, our family foundation, what we're working on. It's not my family foundation. I am the director of the family foundation. My funders, one of my funders started a tech company in Boston. The other funder is a mental health counselor, so that's where the mental health work comes from. I'm going to talk a little bit about the challenge that I'm sure many of you are seeing, but just generally in behavioral health. I know it's a little different than traditional healthcare, and so we want to talk about that. And then we have a lot of really amazing programs that we've built to move people up a career ladder in behavioral health that we can bring to your hospitals and your organizations to retain and recruit a workforce, a diverse and well-supported workforce. So we're going to talk about that and then what it looks like to be a member of BHWI. If we want to go to the next slide. So again, we're a Massachusetts-based family foundation. We really think about behavioral health and the workforce in terms of a well-defined career ladder in behavioral health. So you think about all of the levels of the workforce and the career ladder. You have folks coming right out of high school up through associate's degrees, bachelor's level, and then into master's level clinicians. And we're trying to find models that pay people well up and down that behavioral health career ladder. And then on top of that, how do we move people up the career ladder more efficiently, more affordably? I always give the example of, you have folks who are master's level clinicians earning $60,000 a year, and then they had to pay for a $95,000 master's degree, right? Like the numbers don't really work. The ROI isn't there. Oh, and on top of that, they had to do an unpaid internship for a long time, right? And so when you look at that, like the field has its challenges, and I think that's where we're trying to kind of innovate and create better pathways so that employers like you can retain and recruit a better workforce. We also work on higher ed reform. We have a pediatric cancer research wing of our family foundation as well, but behavioral health workforce is really the vast majority of where our investments are. And go to the next slide. So we have a problem in behavioral health. I alluded to it previously, but we lose a lot of clinicians, right? We're losing clinicians. For every 10 clinicians entering the behavioral health workforce, we are leaving 13, right? Many people go to private practice, maybe people go to other fields, and it kind of comes back to that ROI challenge that we have. We do not have a well-paid and well-supported behavioral health workforce. And so that's part of the challenge that we are trying to address. And then you look at jobs really up and down the continuum, and you kind of understand, one, they're not well paying, two, they're not easy to obtain, and then they're not well supported. And it doesn't really surprise you that we lose a lot of people in this field. And I'm sure many of you are feeling that way or know that all too well with the workforce that you're working with. Go to the next slide, please. Rebecca, you want to take it from here?
So, as Ross shared with that ABH data point from a couple of years ago, part of what we have really been digging into is the nuance of why folks are leaving. And so we know that there's the chronic vacancy and high turnover, especially at the entry level position. We're losing a critical emerging workforce. So a lot of our efforts are around harnessing that pool of employees and helping them advance their careers and their education. The obviously trying to fill the chronic backfills from licensure and the Great Resignation. But folks that are in the field, there's not a clear path to move up and to get into those higher paying positions and also to get into leadership positions. Ross mentioned before the challenge of an unpaid internship. It's a big ask for staff to pause family or to pause their current positions to pursue the higher ed that is required for the advancement. And then we also know from multiple sources, Blue Cross Blue Shield Foundation with William James College, Health Policies Report, there is a persistent challenge around access to supervision in general, but specifically culturally, linguistically, and racially diverse clinical supervision. And then also the licensing challenges, as well as supervision not being covered. And we're very excited about our partners at NASW and the Super Act and efforts to really dissolve the practice of unpaid supervision and unpaid internships. But until we're there, we're really trying to innovate and accelerate initiatives that can get at these chronic and persistent barriers. Next slide. You want me to take this one too, Ross?
Sure. I'll talk about primary care a little bit
Great, go.
since that's so one of the models we really like as an organization and as a family foundation is the collaborative care model. And this is a team-based approach to mental health embedded directly into primary care, and involves a physician, sort of this classic triangle of physician, a care manager, and a consulting psychiatrist. And it uses evidence-based practices and gathers information into a registry to sort of hold this. It has its own unique billing codes, and the unique billing codes are such that it allows a bachelor's level person, not a master's level clinician, to bill for behavioral health work. And it creates a well-paying bachelor's level role in behavioral health. And so we spun off a nonprofit called Helios Behavioral Health, that basically staffs and trains primary care practices into the collaborative care model. We take all the upfront costs away from practices who want to implement a really fully integrated model of behavioral health into their practice. And then after 2 years, we basically show the practice everything. And after 2 years, they can take the project on themselves once they see that it's a financially sustainable model. It has excellent clinical outcomes. It makes doctors really, really happy, right? Because so many times they're getting being asked about behavioral health challenges and they have no solution, or they can't refer people out because there's no real kind of easy button and the wait lists are super long. And so we've started this with a bunch of Tufts affiliated practices. We started with 3 and we're scaling to 9 next month. And so that's one interesting way that we've sort of created this rung of the behavioral health career ladder with a well-paying bachelor's and master's level job in a really highly effective clinical model. Rebecca, you want to talk about school-based?
Definitely. And also, I think one of the things that is, before I get to school base, I think one of the things that's so dynamic about the Helios model is it's not that kind of co-located piece. It's fully integrated with the clinician. And so it's just really exciting to sort of see that really that gold standard of what integrated care can look like. The kind of key domain, if you will, for accessing services besides a PCP is also schools for our younger, well, for school age kids. And so we know that schools are becoming the default provider. They have long wait lists. They, by necessity, are focusing on the highest risk kids, the children that or students that have IEPs. And so they really need some system capacity help. And so part of our kind of still on the drawing board is really looking at a model of care that one centers universal screening in an equitable way and is able to leverage the workforce initiatives that we're driving to actually provide the workforce to deliver care to what traditionally would be known as a tier 1 or tier 2 level of intervention. But right now, given the current circumstances with the behavioral health workforce crisis, as well as the youth behavioral health crisis, we know that those kids are not getting access to care. And the system is really being dominated by that tier 3. And so we're working with some of our partners across the state to really design a thoughtful model here, leveraging codes and really looking at some policy advocacy specific to that domain where people are able to access care. You may just keep going on the community side too.
Yeah, keep going.
Yeah, sure. And then what you all know, but what really our community-based behavioral health providers struggle with is this persistent and growing waitlist issues. That even if they're like a PCP is able to identify a need when they go to refer to an outpatient provider, waitlists, it's just you're not able to access service in a timely way. And so all of our workforce initiatives from that, behavioral health certificate level through our graduate embedded programs all aim to really build a robust and diverse behavioral health workforce that it can operate across all 3 of these tiers. Next slide.
All right, so I can walk through this. Accelerate the Future's invested $10 million since 2022 to expand behavioral health access and workforce development. At the master's level, we have this incredible Learn and Earn LMHC program. That's a licensed mental health counseling program at Framingham State University. It's fully employer embedded. It's super affordable, and it takes a cohort of bachelor's level individuals at any employer, behavioral health employer in the state that includes health systems and community mental health organizations, and it brings them through this master's level program. Framingham State is very flexible in the way that they offer programs, so they'll even send a professor to the site of the employer to teach. And the price is very affordable. We've gotten this down to $15,000 for the entire master's degree program, right? Remember, I talked about the affordability of degrees and people being in lots of debt. We got the price down so much that employers are actually paying for the entire program or a significant portion of it for their employees to go through this. And so this is an example of a learn and earn or job embedded program. That program's grown from 60 students in 2023 all the way to 320 students across 16 employers in 2026, which is really exciting. But also exciting is that we have this incredibly high retention rate. The cohort really sticks together. More than 50% of participants self-identify as BIPOC. And so we feel like we have the most effective, most affordable, most diverse mental health counseling program in the state. At the associate's level, we have also launched something called an apprenticeship associate's degree. And what that is essentially with our community colleges, we have created a behavioral health associate's degree that is built as an apprenticeship. And so it is highly embedded, job embedded learning, highly job embedded learning. And the way this kind of works is that you still take your traditional classroom time, but in addition to classroom time, a lot of the work you do on the job under mentorship or supervision counts for credit for what you're doing. And so it's rather than, taking 40 hours a week in college and then 40 hours a week at your job on top of living life and having a family, it really brings that learning and your work together in a really nice way that allows employers to retain workers at that sort of early stage of the workforce of their career and keep them at their place of employment. This is probably the rung of the ladder where we see the most turnover. These jobs are entry-level jobs. Sometimes organizations are losing 50, 60, 70% of their workforce every single year, and they have to retrain folks. And so community college is free now in Massachusetts. We can keep people at their employer in their jobs while they're learning and kind of starting to move up the career ladder. And then obviously Helios Behavioral Health, integrating behavioral health into primary care. We're super excited about that. We offer a turnkey model. We also offer technical assistance to get this model up and running in as many health systems or primary care practices as possible in Massachusetts. So definitely encourage folks to reach out about that. And then we're also working on a paid internship model through collaborative care. We're working on MSW Workforce Accelerator. So next slide, please. So with all of that, we have decided to launch the Behavioral Health Workforce Institute, which is where all of these programs live. We are Accelerating the Future as a family foundation. We give grants. We wanted to actually hold this and hold the workforce and hold all of these programs in one place. And so we launched BHWI. And Rebecca is leading BHWI, but it's sort of a nonprofit spinoff of our family foundation. Next slide, please. Cool. So, Rebecca, I don't know if you I feel like I missed some things when I was explaining what these different degree programs are that we've launched. So we can kind of take people through every rung of the career ladder that we are trying to address and think about how this applies to folks working in hospitals and to our employer friends at hospitals.
Absolutely. So no, I think you covered it all. And this just really kind of folks can see words on page to let it really settle in. I think some of the key highlights is the cohort model with the employer. We know from our research and learning partners, Brandeis, they are monitoring and evaluating our FSU model. And the students themselves credited the cohort model as a reason they were able to stay so engaged. and really navigate two very demanding full-time work and full-time school. And so the apprenticeship degree program copies that. And so you're able to, in some cases, if one employer fills all 20 seats, the faculty are actually able to go to the employer site to deliver instruction. So again, just removing another barrier, not expecting people to work full time and then go to campus on Saturday. And what we're finding is that all of these are helping both in terms of recruiting workforce, so filling those persistent vacancies, but also keeping the folks that are there, and then growing your own clinical workforce from that piece. So, and then the other piece I want to add that I think is worth repeating is all of the actual academic work is stackable. So it's by design building, which you'll see as we progress into the next step. And so it's not learning to check a box. It's actually learning to meet the requirement to then build into a bachelor's degree. Next slide. So when Ross was going over that initial slide with sort of our flagship programs, we were at the associate level and at the graduate level. And we realized we really needed that bridge piece. So they had those stackable credits. They they have half of a bachelor's, or excuse me, half of an associate's degree. So how do we keep them on the educational path? And so we designed the Bridge Academy right now in partnership with Salem State School of Social Work. And what Salem State has done with support from ATF, they've designed a completely online accredited bachelor's completion program in social work. So folks that come out of the community college apprenticeship degree program are able to apply to Salem State, still using an employer cohort model. If you didn't have an employer cohort model at the apprentice program, and this is really your entry point, that is totally fine. It's sort of a pick your own adventure. Whichever model most resonates with an employer's immediate need is where they can start. But the university has a Bridge Academy coach, if you will, to really help be that single point of contact. So as students are navigating admissions, financial aid, coursework even, which, professors to talk to about challenges there, it's a highly supportive model for folks. The coursework aligns with the employer's needs, and the students are able to complete their practicum on site at their employer. I think one of the biggest kind of radical at this point ideas that our employer partners have agreed to is this 4 hours of weekly paid time off. We recognize the burden and the barrier of managing both full-time work and full-time school. And so by just carving out those 4 hours, there's a couple options. Again, with this design, since it's completely online, if one employer filled all 20 seats, they could reserve the conference room and have everyone attend their classes during that 4-hour window. Or it could be time that they individually have to study or complete school assignments. So trying to make it a more flexible and manageable process at this bachelor's completion program. And we're really focusing on social work because, as most of you probably know, if you have a bachelor's in social work, you're eligible for an advanced standing master's. And so the Bridge Academy is really a dedicated 5-year track that we can move folks that have an associate's degree to an independently licensed social worker in 5 years, with 2 years at the bachelor completion level, 1 year at an advanced standing master's level, and then 2 years to accrue the required supervision hours to sit for the LI. So this is a brand new program. We're launching our initial cohort this fall, and we're very excited to expand. What are the most common roles enrolling? Chuck, I don't know if you mean enrolling at the Bridge Academy level or the apprenticeship level.
Maybe both. I mean, I think this is an interesting
both.
this is an interesting conversation with hospitals in general, right? It's like, and just behavioral health
Both. Yeah.
in general, right? Because it's like, well, what are the jobs for people
Yeah.
with associate's degrees? What are the jobs for people with bachelor's degrees? And it's not super well defined. Like in nursing, everything is so well defined. This is so stackable. If you have a bachelor's, you're this. If you have an associate's, you're that. Like behavioral health is a little more vague and broad than that. And I think so that's a really good question and an important thing to discuss. And also something we want to hear from you during the time of question and answer, and perhaps an opportunity to answer some poll questions for us. So let's hold on that for 1 second, and perhaps we can get through the rest of this, and then we'll
Sure.
dive into that question.
Awesome. And oh yeah, and then this is our graduate program. So we have Ross, actually, do you want to talk about this just because of the New Jersey one first?
Sure.
You
Yeah.
covered FSU.
Yeah, so we have Framingham State as a licensed mental health counseling. We also worked with the College of New Jersey to register a counseling program as an apprenticeship, which is really interesting. And I think they're the first in the country to register, like to do a federally registered apprenticeship program for specifically for a master's degree in mental health counseling. So that's really interesting. And then we are working to get to a social work integrated model. But the important thing with all these programs is really any behavioral health employee working in Massachusetts at an employer who is doing behavioral health has access and should have access to one of these programs to continue to move up the career ladder. It's almost free or a free program that allows them to continue their education and essentially upskill while they are working. And that is what we want to reiterate. And so if you think about any of your employees, like, and they want to continue or become social workers or become independently licensed in this mental health work, we want to have the programs that are job embedded, that are flexible and can continue to move them up the ladder, the career ladder. We'll go to the next slide.
Thanks, Ross.
Oh, and there they all are. So here's the nice career ladder. And so maybe this is a good time to kind of start the conversation around like, what are these jobs? Like, honestly, we've worked more with community behavioral health providers, think like Wayside, Advocates, Open Sky, Seven Hills, and Worcester, like the more sort of traditionally behavioral health organizations. We have done less work with hospitals and healthcare systems. However, that work is starting to come. And we have some interesting partnerships with Tufts and Beth Israel. And so, I think we want to learn more about the types of positions and the behavioral health folks that are in the workforce and what, like, where your needs are. I don't know how to best do that on this webinar because we can't have people, I guess, ask questions, but we do have those poll questions, which might be super helpful and interesting for folks.
We can say that in terms of what we're seeing from the folks that are involved with us, we're in terms of the role, we're seeing folks that are community health workers that have applied and been accepted under the Bridge Academy. I believe it's referred to as a mental health tech in terms of the associate level.
Behavioral health, BHT, behavioral health tech.
Yep. So I think those are the two very specific roles that first come to mind, specific to healthcare systems. Of course, in community care, we're capturing therapeutic mentors, family partners, actually CHWs there as well. But yeah.
And then typically, like, I believe care management or care managers, care coordinators.
Care coordinators, yeah.
And again, this kind of gets back to the sort of vagueness of right.
Yes.
Well, right. So like this gets back to sort of the vagueness. Like a lot of these positions don't require an associate's degree to fill, right? They don't require a bachelor's degree in order to do therapy or psychotherapy. Like you need to be a licensed clinician or a social worker, right? But the other positions, like a lot of them are lived experience, right? They require many of them in behavioral health require a high school degree and some lived experience, right? That's like your peer specialists and recovery coaches, therapeutic mentors. And so it is vague, but I think these are good examples that Tiffany shared as well.
Yeah. And I think one of the in a way, the simplicity of it is almost can seem like we're missing something, but it's almost more about, or it is about the educational starting point. So regardless of what their title is, if they have an associate's degree and they're interested in building their career, then they would be able to begin this journey at the Bridge Academy with the BSW. If it's a person, as Ross was saying, with a high school diploma, then they would start at the associate level or even the certificate. So I think in terms of navigating which opportunity would most resonate with your workforce, I think it's understanding sort of where do you have a cohort of 5 to 25 individuals? What is their shared educational starting point? High school, some college credit, or an associate's degree. And then you're able, or a bachelor's, and they want to go into that master's level.
And I think too often higher ed has been sort of stubborn about how they offer degree programs. And it's, well, come to campus and you have to like be a student of ours and you have to come and learn here. And the times are not flexible, and more have started doing online courses, but I would not say these have been sort of employer friendly models of education in the past. And I think what we have done really well is sort of flipped that on its head. And we say, okay, these are actually employer driven models of higher education. Can you deliver a degree program in a way that is for the employer and for the employee, and be more flexible, be more efficient? And we're trying to pull all of those levers. And there's great opportunity in Massachusetts too, because community college is free now for everyone. There's a lot of money in Pell Grants, and then there's money from the state to sort of make these degree programs free up through a bachelor's degree. And then we've really pushed on the affordability of these programs at the master's level as well.
Yeah.
So that's kind of I guess that's our innovative magic potion there.
Yeah. And I think, oh, sorry, Ross.
No, go ahead.
I was just going to say, I think employer voice is incredibly critical to everything that we're designing. And so as we've been working with our current employers across, the entire continuum, we keep hearing that supervision is an issue, that licensure is an issue. And so we are now iterating sort of the next level. We have figured out what we think is a really doable education pathway, but it actually doesn't stop after you get your master's. And so some of the new programming that we're currently designing would be considered like benefits for employer agencies that we're members. And so one, we really want to design an initiative that gets at culturally responsive clinical supervision and diversification of that leadership level. We've heard a lot about the need for mentorship and executive leadership for sort of the folks that have been in the field, but they want to grow into that executive level or C-suite. So what are the opportunities to support that level of the workforce? And then, of course, licensure is just a big challenge. We're all very aware of the bias in both the LMHC and the LICSW exams. And so we're looking to partner with an educational app designer to use AI. We keep referring to it as bust the bias, but to increase pass rates for Black and Latinx clinicians to be more in line with the 80% pass rate of white clinicians on the first attempt. Anything you want to add here, Ross?
Nope. I think
Okay.
my last ask is that anyone who's thinking about behavioral health workforce or struggling to retain or recruit, or wants to keep folks in their organization through these methods, just reach out and talk to us about your behavioral health workforce. I think we're just really excited to have all those conversations and learn a little bit more, and also figure out how we might be able to solve some problems for you too. So
You teed that up perfectly. So next slide, and I think this is going to work. To get in touch with us so we can learn from you and share what we're doing, this is our website. And if you, I think they're going to put it in the chat, but if you go onto our website and hit join our mission, you will have 3 different options, and you can put your information in there and we will follow up with you. There's Is the link not working?
I could put it in the chat.
Okay, I think, yeah. I'll
Oh,
also, well,
there we go. Beat me to
oh,
it. Nice.
oh, perfect. So I'll also say while we're doing that, we want to plug the June 2nd and 3rd event for any employers?
Yeah, I think definitely.
Yeah. So for anyone, any employers on the call that maybe for you right now, it's really filling and retaining that entry level workforce. And sort of the thought being once you get them in the door, then there's additional opportunities in partnership with the Behavioral Health Workforce Institute to keep them. But let's start at the entry point. How do we get folks in? We are we're bringing in some experts, the Competency-Based Education Network, to have a 1.5 day planning session with us. And the audience is broad. We have our higher ed partners, both at the community college and the four-year college, and actually graduate level. We have employer partners, and we have some of our trade organizations, as well as the National Association of Social Work, to really dive into specifically the on-the-job competencies. What is it that you would want to know that your workforce could demonstrate at that entry level position to really succeed in their job? And so, if you have an interest in participating in that conversation, we will end up ideally with standardized domains and standardized competencies that all community colleges that we're partnering with to offer that apprenticeship degree program, they each individually own sort of the traditional classroom instruction. This is specifically looking at that on the job competency, which again, they get credit for towards their degree. So if on the website, you'll see the green banner, and you're more than welcome to sign up and really represent the unique hospital healthcare workforce voice in that convening. Next slide. Perfect. Do you want to take these, Ross?
Sure. Do we have poll
Awesome.
capabilities going?
Think
Okay. So
so.
we want to do a little poll.
We
Hopefully
might have
this will.
to just have people put it in the chat.
Oh, okay, that's fine. No worries. So first, we're sort of curious hearing from you, which behavioral health role is currently the most difficult for your hospital system to recruit and retain? So are these entry level folks, master's level clinicians, fully licensed independent clinical social workers, LICSW, psychiatric nurses or nurse practitioners, integrated behavioral health providers in primary care settings, or other? Or none, which I don't know. Maybe that's a thing too. Okay, we have a master's level. Yep. Okay. So it's interesting because we're
Yeah.
hearing a lot of clinicians at clinical level, psychiatrists, right? These are the high end of the
Yep.
career ladder. I guess a follow-up question I have is just around like those entry level positions. Are they being hired for? Are they able to sustain themselves through billing? And uh or is that not some, and then also like is there huge turnover within those positions, or if they kind of hold their own? Yep, entry level and retention.
Yeah.
um Interesting.
Yeah. Due to work. Yep. Billing expectations. Absolutely.
Interesting. Okay, let's go to the second
Yeah.
poll question. Okay, so this one's about like which setting is your hospital experiencing the most acute behavioral health staffing shortage? Emergency department, inpatient psych units, outpatient, integrated primary care, or other, not applicable. Um, I know every hospital is a little different in terms of what they offer, so this may not apply to everyone. Mm. Hmm.
Oh, interesting. Specifically pediatric.
That's, yep. One of our major goals with integrating behavioral health into primary care is to prevent emergency department visits. And that's sort of statewide, I guess, in any setting, right? Is to keep kids out of the emergency department for behavioral health needs, which means catching kids earlier, addressing issues earlier, right? Integrating into primary care where all these behavioral health concerns first present it gives folks an immediate access to behavioral health care and keeps them out of the emergency department. Um, oh, okay.
Yep.
So, all right. So folks can't see the responses. So, um, yes. So we're hearing emergency department and inpatient units, inpatient, which leads to emergency department issues, um, outpatient clinic in our community behavioral health centers. And then we're hearing just about paperwork expectations, is what the clinicians complain about the most, which is interesting. Um, and
Mhm.
Tiffany says PCPs should be sending them to the local mobile crisis intervention teams, in that.
Yes.
Absolutely. Outpatient child psych,
Yep.
especially
Yep.
therapists. Okay, we will go to poll question number 3. So this is about retention of staff, and what is the primary way that your organization supports frontline staff seeking advanced behavioral health degrees? Do you guys have true tuition reimbursement programs? Is there flexible scheduling? Do they do paid clinical supervision or practicum placements? Or do you have none of those structures currently in place? Or do you have like a sort of, or do you already have a sort of learn and earn or embedded learning opportunity? So we got one traditional reimbursement and then flexible scheduling where possible. We know that it's always difficult,
Great.
um, but that is great. I think a lot of employer partners have tuition reimbursement. I'm seeing another one for tuition reimbursement or loan forgiveness or payback. And looking to start an internal workforce academy this summer, which is very cool. Um, I think what we've tried to find is that sweet spot of cost of programs and what employers could pay for, because, look, like certain social work degrees in Massachusetts cost $95,000, right, for the whole program. Uh, and a lot of employers can pay, $3,000 a year, $5,000 a year. And so it's sort of unfortunately, it's a drop in the bucket for what the degree costs. Um, Meanwhile, there aren't, Pell Grants or other things available for graduate level programs. And so in developing these programs, we've really focused on working with our state universities, to make them affordable, right? So as I mentioned, the Framingham State program is $15,000 for the whole program, and that's over 3 years. And so when you think about $5,000 a year for 3 years, that's something that the employers have been able to pay for almost entirely and allow this to be a debt-free program for the students and the employees. And then they can say, well, we paid for that program, so you need to stay an additional 2 years or 3 years after you graduate. So you can hold on to somebody for 3 to 5 years just by keeping them in this program and paying for it. See some other tuition reimbursement, loan forgiveness. Someone wants to increase other opportunities, which is great. I see another tuition reimbursement, flexible scheduling, paid internship. Oh, wow. There you go. And we have one who already works with Behavioral Health Workforce Institute with the Framingham State cohort and the BSW cohort. So that is incredible and very glad to hear it. All right, let's move on to the next poll question. This is about entry-level staff. So when they leave to pursue higher education in behavioral health, what is the most common reason? Is it because of the inability to balance full-time work schedule with academic? need to complete unpaid internship practicum during work hours? Is there a lack of a clear advancement pathway within the hospital? Financial barriers, so the cost of education versus current salary, or are folks feeling like you generally retain them during their educational pursuits? Just want to talk to all of you. Next time we're just having a big meeting. I just want to like put everyone in a room together and talk.
Talking stick. Everyone answers.
Yeah, next time we'll do that. Got it. Okay, so one person said we generally can keep them if their role has flexibility for part-time. So they have to move kind of to
Oh,
a part-time
interesting.
part-time
Part-time.
role. Which isn't ideal for everyone, but it is a solution for sure. Balancing schedule. So someone else said balancing the schedule, lack of career advancement, especially for leadership positions.
Yep.
But they have made good progress for provider training. Financial barriers, scheduling to allow them to attend school. Okay, great. Let's move on to the next. I promise there's only a couple more. So this is about what your priority is. So expanding access to behavioral health, which workforce strategy is the highest priority for the next 12 to 24 months? Is it upskilling existing frontline workforce through degree practices, expanding integrated behavioral health like collaborative care or PCBH model in primary care, increasing the pipeline of diverse, bilingual, and culturally competent clinicians, developing better internal clinical supervision structures, or partnering directly with higher education institutions for talent pipelines? Or none, or all, multiple. It's fine as well. Ooh, you got into
9484.
got into some billing code talk.
Yeah.
Now we're talking. I'm excited about that. Happy to talk to you about expanding collaborative
Yeah.
care. That's something we're excited about always. What's
Diversity.
99484?
Oh, God, I knew you were going to ask.
All right, sorry. Geez, someone will tell us on this chat.
Yeah, they will.
Increasing pipeline of diverse, bilingual, and culturally competent clinicians, and partnering directly with higher ed institutions for pipelines. Awesome.
Interesting.
Reach out to us. Oh, general. Okay.
Yeah.
General BHI. Right.
Yeah.
Easier, yes.
Interesting.
Potentially not as maybe doesn't pay as well,
Yeah.
but I'd love to like dive into that a little bit and learn about it. Increasing our pipeline. We have to. Oh, yes.
Oh.
Okay. Well, let's talk again. Upskilling existing frontline, increasing diverse. So it sounds like there's interest in a lot of these different programs, which is great. We want you to reach out. We want to talk. We want to talk again if we've already talked. Let's go to I think we have a last poll question here. So, okay, this is about Bridge Academy specifically. When we talk about a learn and earn, like let's say you have a bunch of associates level staff, they have associate's degrees, they want to earn bachelor's degrees and be in social work and then continue to move up to become a licensed clinician. Okay, nice. Already fully implemented. Is 4 hours a week of paid release time for staff to complete behavioral health degrees. Is that feasible or not feasible? One being not at all feasible, like we could never do that. 2, 5, somewhat feasible but challenging. I see a 2. I see a 5. I see a 3. External funding, partnership support makes sense. Another 3.
Okay.
And a 2. So this seems to be possible but challenging. It seems to be the general consensus here.
I will say, and this is where Ross and I are so good because he has the economics background and I'm a social worker. We would have to go back and look specifically, but it was interesting to look at what agencies pay in terms of advertising, interviewing, hiring, training up, sort of the costs for that for these high turnover positions, versus the cost of losing those productivity hours for the 4 hours. And so I think that's something we should integrate that onto a slide, probably, Ross. Because the punchline is you actually save money by eating the lost productivity. But yeah, we also know that that's a big ask for employers, but it's very
Totally.
critical for the flexibility for the employees.
Does anyone have any other questions? There we go. Closing slide. Yeah, happy to answer any other questions. Also, just extending the invitation to reach out again and get in touch with us. I'm going to put my and Rebecca's email on here too, or you can go to the website. Either way is good for us. But yeah, we're really excited about what we've built. We're also eager for more employer partners to try to solve some of these problems with us. And yeah, we hope you'll reach out and get in touch with us. And we're also just appreciative of the opportunity to meet with all of you and speak today. And oh, Kim's got the emails. There we go. Cool. And if there aren't any other questions, thanks again. And we hope to hear from you. Thank you, Emily.
Rebecca and Ross, thank you so much. Great webinar, and definitely informative for us as well, to understand where the needs are and what's happening out there. So thank you so much. We appreciate your time and being here today. And I think, Amy, are we sharing the upcoming educational programming, or are we just skipping that one? Okay, we'll send it out. Okay, excellent. Well, thank you so much. I hope everyone has a great rest of the day. We will be sharing the slides and the recording with everyone, so you'll get that in an email soon. And definitely check out our website too for upcoming events. Thank you all. Take care.
Thanks, everyone.